What should healthcare professionals consider when planning your end-of-life care?
Every patient's different, so before talking to the patient, we may be uncertain about what they may want in regard to their care, both now and in the future. Having an open conversation with the patient allows us to provide them with all the information that they need about their condition and treatment, and it gives them the opportunity to tell us about what's important to them, their needs and wishes. Then, as doctors who have to make decisions in the future, we feel more confident about what is right for each individual patient. And this can be much easier than you think, even if the patient's goals and values and beliefs are different to your own.
I really want to know all the pros and cons of life-prolonging treatment versus quality of life. How do we weigh up the benefits and burdens of treatment? What does the inclusion of palliative care mean? Do I want the experts involved for my pain and symptom relief? Tell me honestly, what are my options?
Everyone deserves a chance to tell us who they are and what makes them individual. As health professionals, we need to seek out the person in the patient every time and find out what's important to them when they're making decisions about their current and future health care.
It's important the doctors talked with me. As the palliative care nurse within the palliative care team, I work with Pam, her family, the treating team and her general practitioner. There is so much we can do together, and this makes our work very rewarding. Palliative care is about living. It improves the quality of life of patients and their families facing life-threatening illness. It provides relief from pain and other distressing symptoms, offering a support system to help patients live as actively as possible and regards dying as a normal process. Palliative care intends neither to hasten nor postpone death, integrating the physical, psychological, emotional, spiritual and social aspects of care for the patient, the family and close carers in a culturally sensitive manner.
I'm so glad my doctors listen to me. I know I can't be cured, but I'm not giving up, even though I have chosen not to have any more chemotherapy. I'm confident I'll continue to receive the active care that I need.
Patients can often feel overwhelmed by health systems and their health status. As they experience functional decline and become dependent on others, they may feel burdensome. The essence here is to listen to patients and their families and work on creating an environment that invites discussion and questions. It's important people feel they can retain control over healthcare decisions being made about or for them.
The doctors and nurses really gave us the information we needed through honest discussions and in a language we could understand. This knowledge was so helpful in us making decisions that we're all comfortable with. Now Pam and I are having some honest conversations about the time she has left and setting realistic goals. The treating team, in collaboration with the palliative care team, have helped guide us through this process, and now we've developed a treatment plan.
My future's not without hope. It's just that that hope has changed. I now hope to spend more time with my family. There are no right or wrong decisions, I know that. And my choices can change from day to day, if need be.
Patients can have confidence in their decision-making, knowing they've been informed of all treatment options, as well as information about the burdens and benefits of treatment options. Patients should have the option of palliative care in a treatment plan or treatment options that include palliative care. When having these conversations, it's important to use understanding language and present information in a neutral, balanced manner. Pamphlets, websites and books are also all valuable tools in helping patients make the best decision.
Everyone's story is different. If English is not your first language, there are interpreter services available. No matter what your background, language need not be a barrier. English is not Ron's first language and he lives alone. Social workers help people in many ways. As Ron has no direct family support, he will need help to remain independent. For Ron, this is important, as home is where he wants to be.
If you are living alone without family or friends available for support, or suffering from mental illness or other isolating conditions, social workers can provide counselling, support and links to other valuable community services.
Well, Pam's goals of care and her advanced care directive are living plans and can easily be changed as her condition or wishes change. Choosing to have full treatment doesn't exclude palliative care and vice versa. And remember that dying is not a medical failure, it's a natural part of living.
I'm so pleased the doctors talked to us about what we can do. Mum's comfort is so important to us. We wanted to have enough pain relief, and we don't want to have treatment that has limited benefits. The doctors say that Mum could possibly die in the next few months, and she knows this. And now she has time to plan the rest of her life. We won't see her death as medical failure.
Family and friends need to feel confident that they can leave their loved ones in the care of medical and nursing staff, knowing that they'll receive relief from pain and suffering, and that staff will be responsive to their loved ones' needs.
I'm so grateful that the doctors talked to us. We feel like my sister and her decisions are being treated with respect. I know Pam would hate to be a burden on anyone, and she finds it hard to ask for help. And the treating team are aware of this. It's really important to us as her family to be able to care for her, and she knows that we have the support that we need.
After the doctors talked to Nan, she asked me to do a really important job and look after Coco, so she doesn't have to worry.
Every patient's different, and it's about giving them the information about their healthcare options and finding out what's right for them. It's important that decision making is shared by the patient, their doctor, and if the patient wishes, by the family. So when it comes to your turn, what do you want your doctors to consider when planning your care at the end of your life?